Your doctor has prescribed insulin to lower your blood sugar. Whether you are new to insulin or have used insulin in the past, feeling comfortable and knowing the right technique is important to getting the most benefits from insulin. This instructional video will walk you through how to give yourself an insulin injection, properly dispose of your insulin supplies, and review how to identify and treat low blood sugar. Let's get started by washing our hands. It's important to always wash your hands with warm soapy water for at least 20 seconds prior to giving an insulin injection. Insulin helps take the glucose in your blood and move it into your cells to provide energy. All patients with type 1 diabetes and many patients with type 2 diabetes need insulin to lower their blood sugar. Many patients need two different types of insulin. Basal or long-acting insulin is insulin given once or twice daily to control your blood sugar overnight and between meals. Basal insulin should be taken every day, regardless of eating. Bolus or mealtime insulin is given with the first bite of a meal and prevents a large spike in your blood sugar after eating. Bolus insulin should be skipped if you skip a meal. Insulin should be given in the abdomen, back of the arm, upper leg, or top of the bottom. Injections should be rotated to different locations every time. Even if you always inject in your stomach, move your injection site a few inches each time, but always stay 2 inches away from your belly button. Rotating the site of injection will help reduce the risk of scar tissue development or infection. Gather your supplies. If you use an insulin pen, you will need your pen, a pen needle, and 2 alcohol wipes. If you use an insulin vial, you will need the vial, a syringe, and 2 alcohol wipes. You should use a new pen needle or syringe for every injection. We'll start with how to give an injection with an insulin pen. First, clean your injection site with an alcohol wipe. Make sure to let the alcohol dry before injecting. Take the cap off your pen and wipe it clean with the second alcohol wipe. Take a new pen needle and peel off the paper backing. Twist the pen needle on your pen. Attach the pen needle immediately before you give an injection, and do not store the insulin pen with a pen needle attached. The pen needle has 2 caps, an outer cap and an inner cap. Take off the clear outer cap and save it. Carefully take off the inner cap, exposing the needle. Before every injection, you should prime the needle or give a test shot of insulin. Turn the pen dial to 2 units. Turn the pen so that the pen needle is pointed straight up. Press the button and you will see a spray or drops of insulin at the end of the pen needle. Priming the pen needle gets all the air out of the needle and ensures that the pen is working and dose is accurate. Now dial the pen to the dose prescribed by your doctor. You are ready to give the injection. If you are using a nano pen needle, there is no reason to pinch your skin. For all other length pen needles, gently pinch your skin where you are going to inject. Inject at a 90-degree angle into your skin. Push the pen button and watch the dial turn down to 0. Count to 10 before removing the needle. Put the clear outer cap back on the pen needle and twist off to remove the needle. Never store your pen with a used needle attached. Put the cap back on the pen to keep it clean. All sharps should be disposed in a sharps container. You can make your own sharps container by using a hard plastic bottle, like a laundry detergent or milk jug. South Carolina Department of Health and Environmental Control, or DHEC, provides free stickers to place on your sharps bottle. When your sharps container is 3/4 full, it can be thrown away into the normal trash. DHEC will mail these stickers to your home for free, or you can print them from their website. Now, we will review how you give an injection using a vial and syringe. Clean your injection site with an alcohol wipe. Make sure to let the alcohol dry before injecting. If you use an insulin vial, always clean the top of the vial with a new alcohol swab before each injection. Use a new syringe for each injection. Each syringe has 2 caps, an orange cap that protects the needle and a white cap to cover the syringe plunger. both of these caps will be removed prior to using the syringe. To draw up your insulin dose, first draw air into the syringe equal to your dose of insulin. Insert the needle at a 90-degree angle. Push the air into the vial. Flip the vial over to withdraw insulin. Pull back on the plunger until you have the correct amount of insulin in your syringe. Be sure to measure at the top of the black plunger. If you have any air bubbles, push them back into the vial and pull out more insulin until your dose is correct. Air bubbles will not hurt you, but your dose will not be accurate. If using a syringe, hold the syringe like a dart and gently pinch your skin where you're going to inject. Inject at a 90-degree angle. Inject the insulin and count to 10 before removing the syringe. Throw the syringe directly into your sharps container. Never recap a syringe. It is important to store insulin correctly. Unopened insulin from a pharmacy should be kept in the refrigerator. Unopened insulin is good until the expiration date on the box from the manufacturer. Once you open a vial or pen, you can store it at room temperature. Never freeze insulin or leave it in a hot car. Each insulin has a different expiration date once it is opened. Look at the packaging or ask your pharmacist. Once insulin expires, it does not work to lower your blood sugar. The most common side effect of insulin is hypoglycemia or low blood sugar. Symptoms of hypoglycemia include shaking, sweating, heart racing, hunger, anxiety, dizziness, blurry vision, headache, weakness, or being irritable. If you feel any of these symptoms, follow these steps. Check, treat, check, eat. First, you should check your blood sugar. Blood sugar of 70 or less is considered hypoglycemia. If you are pregnant, blood sugar of 60 or less is considered hypoglycemia. Next, treat a low blood sugar with 15 grams of a fast-acting carbohydrate, like 4 ounces of juice or regular soda, a tablespoon of sugar or honey, or a hard candy like 6 Lifesavers or 3 peppermints. Look at the package to determine the number of pieces to get 15 grams of carbs. If your blood sugar is below 54, treat with 30 grams of carbohydrate. Wait 15 minutes and check your blood sugar again. If you are still low, repeat the 15-gram treatment. Continue to repeat these steps until blood sugar is corrected. Once your blood sugar is corrected, eat something with protein or fat to prevent from having another low blood sugar. If it's more than an hour until your next meal, eat a snack like peanut butter crackers or half of a sandwich. If you have more questions, ask your pharmacist or diabetes educator. You can learn more at the GHS Diabetes Self-Management Program. Call today for more information.